You're wasting it. Wasting your money on it. Those are the metabolic treatments. So we have to know what's happening inside your body, how it's affecting your stroke. And from that information, we then will combine that with neurological treatment. Well, what is neurological treatment? Neurological brain-based treatment is the treatment of brain and nervous system tissues. Okay? Your brain needs two things, oxygen and fuel in the form of sugar or glucose. But it has to be the right sugar or the right glucose. Okay? We provide the right types of sugars, and we provide oxygen therapy to our patients to rehabilitate damaged tissue. Okay? In stroke victims, it's very important. Your brain also needs activation. If a part of your brain has been damaged by a stroke, either an ischemic attack or a blockage or whatever, and has killed off parts of those tissues, that part of your brain needs activation. It needs to be stimulated again so it can start working properly. We use EWOT therapy. EWOT therapy means exercise with oxygen therapy. Okay? If you exercise your hands or legs while you're breathing concentrated oxygen, you're firing the part of your brain responsible for movement in the body. So if your stroke has caused the left arm not to work very well, and we fire and stimulate the movement portion of your brain, we can actually make it start working better again. Brain-based therapy, sometimes we use vibration therapy. Okay? We'll vibrate your body and your brain at a frequency that stimulates it. Okay? Laser therapy. We actually use a laser to stimulate tissues, help heal damaged tissues. Decompression therapy. If we have a disconnect between the brain and the lower body, it may be because somewhere in your spine or spinal cord there's a compression. Well, if you decompress that, or if you open that channel of communication again, your brain can then communicate with your leg, for instance. If your leg doesn't work for your stroke, we want to get that connection from your brain to your leg working. Okay? Sometimes we use an interactive metronome, which means we're training right brain and left brain. Why is that important? Well, it's like a car engine. If you have 4 cylinders on the right and 4 on the left, the 4 on the right are going down the road at 3,000 RPMs. The 4 on the left are going at 1,200. Okay, how far is your car going to get down the road? Not very far. Well, how far would your brain go? How well would your brain work if the right side of your brain is going 3,000 and the left only 1,200? Okay, your brain has to be working equally, or the rest of your body can't work. Now, we want to ask you 4 simple questions about this, about stroke. 4 questions. How has your stroke affected your job, your relationships, your finances, your family, the activities you want to do? How has it affected you? What does it cost you in terms of time and money, happiness, sleep? What does it really cost you? Where do you picture yourself in the next 1 to 3 years if you don't get this problem taken care of soon? Where do you think it's going to go? Probably worse. What is it worth to you if someone could improve your condition? Is it worth your time? Is it worth your effort? Is it worth your listening to the doctor and doing the types of things you need to do to better yourself? Because if it's not worth it to you, then you're wasting your time. If you can't put in the effort, you're not going to get well. Many people ask me when I do these talks, what do I do next, doctor? What do I do? Well, here's what you do. You call our office, 479-271-6992. 479-271-6992. Ask for an evaluation. Ask for a free evaluation to see if you're a candidate for my program. We're going to run 4 basic neurological tests on you. Okay? When you schedule your appointment, they're going to make you 2 appointments. On the first day, we're going to run these tests. We're going to check these 4 basic tests. On the second day, I'll personally sit down with you and we'll go over your results, and I can tell you yes or no if I can accept you as a patient. Now, last year in this Bentonville clinic, we treated 18,203 patients. We simply cannot accept patients in this office that are not serious about changing their life. I will only accept the most promising and most beneficial patients. We will not accept you if we can't help you. So don't waste your time, don't waste your money if you're not serious about it. Because I'm here to change your life. When you come in, again, I'll give you a copy of the book, Brain-Based Therapy, that has the chapter in there, Brain-Based Therapy. I'll give you a copy of the chapter. I'll give you a copy of the chapter on strokes. We'll give you a DVD on stroke recovery. This is a DVD of patients that have gone through this treatment and have been so successful and so happy they wanted others to know about it. You'll even be able to read a book we have called Clinic Success Stories, where we have hundreds and hundreds of letters from patients thanking us for changing their life. Now, I hope you're one of them. Call our office, make your appointment, change your life today. I'm Dr. Jeff Smith. I look forward to seeing you in the future. Have a blessed day.
All right, so this is Barbara Strum. Barbara was here originally for, you were here for weight loss, I think, right?
Yes.
Originally, but what we found was that you had some cancer, some chemotherapy, and other things that caused some brain issues that kind of prevented you from losing weight, but caused some other health issues as well, right?
Yes.
Okay. So what we decided to do is put you through the brain-based program prior to putting you on the actual weight loss program, correct?
Uh-huh.
All right. So in terms of the brain-based therapy, we had some memory lapses, we had some coordination issues, you had some weight gain, obviously, those kinds of things. How did you benefit from going through the program so far?
The first and most noticeable thing that I experienced was the fact when I would turn my neck, it wouldn't grind anymore. I hadn't really thought about it in the past, but it was like it was well oiled and lubricated and quit grinding. Then after that, I've noticed that I feel sharper. Not sure if I am, but I feel sharper, and I've lost some weight through. I'm not sure if it was strictly this, or I've also changed medications with my doctor, but I have lost, I want to say 8 pounds, I think. 8 pounds.
Well, we actually put you on a little bit of a food restriction diet with the brain-based program, too. So we hadn't even started the weight loss program yet. You still lost a little bit of weight, so that's good. What about things like memory, short-term, long-term memory, those kinds of issues?
As far as the memory, it seems to be nice and clear. My brain feels clearer.
Not foggy, that kind of stuff? Clear-headed?
I feel much better, yes. Okay.
What kind of work do you do?
I'm a detective up in Bella Vista.
So it's pretty important that you're clear-headed.
Yeah, and with the chemo, I had that, what they call chemo brain, I had blank spots. And
that's very similar to fibro fog for fibromyalgia patients. Absolutely.
It's a rough thing for this job.
Thank you very much.
I've been coming to Dr. Smith for quite a few years for back problems, and when he mentioned fibromyalgia, I said I've had fibromyalgia for 16 years. So he suggested the brain-based therapy. From the day I started until today, I have had not even a hint of fibromyalgia pain or symptoms. I just can't thank Dr. Smith and his staff enough, and I am a true believer in brain-based therapy.